So good evening, everyone. We would like to welcome you all to our first session of the Health and You Community Wellness Series. So the overall goal of the series is to create community awareness about health and disease. And the ultimate objectives of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. So just some housekeeping rules. Your cameras and microphones are turned off. Please use the Q&A feature to type in your questions or any comments. All questions will be addressed at the end of the session. And just a reminder, these sessions are geared towards the public. So our audience is the public, the general population. It's not a CME CPD activity, but of course, healthcare practitioners or anyone from your families, friends, anyone is allowed to attend these sessions. No certificates of attendance will be issued since it's not a CME CPD activity. So here is our first speaker for today. Doing the inaugural talk, Dr. Mamtani. It is my honor and privilege to welcome Dr. Ravinder Mamtani. The title of his session is To Take Charge to Better Your Health. And this session will explore the contemporary culture of health and disease and discuss the role of self-care. Dr. Mamtani is a professor of population health sciences, professor of medicine, Center for Global Health, and Vice Dean for Student Affairs, Admissions, Population Health, and Lifestyle Medicine at Weill Cornell Medicine-Qatar. He's also an adjunct professor of Community and Family Medicine at New York Medical College, Valhalla, New York. Prior to joining WCM-Q in 2007, Dr. Mamtani was a professor of Clinical Community and Preventive Medicine and Associate Professor of Clinical Medicine at New York Medical College, and a physician in occupational medicine and complementary medicine at Westchester Medical Center in Valhalla, New York. He has many years of clinical experience utilizing lifestyle medicine to treat chronic diseases such as chronic pain, arthritis, mental health conditions, gastrointestinal problems, obesity, dyslipidemia, and diabetes. He has published in peer-reviewed journals and has written a monthly column for a local newspaper in New York on contemporary health issues. Dr. Mamtani serves or has served on many government, hospital, and medical school committees in the United States and in Qatar. He is a diplomat of the American Board of Preventive Medicine in the specialties of preventive medicine and occupational medicine, and he is also US board certified in lifestyle medicine and integrative medicine. Dr. Mamtani, it is my pleasure to invite you to the podium. Welcome.
Great. So once again, Salaam Alaikum, good evening. Dr. Chima, thank you for that nice introduction. As Dr. Chima pointed out, this is a seminar series that we have started at the Institute for Population Health, and it's entitled Health and You. And we want to empower you with everything that we know about health and disease. So our inaugural talk, which is this one, is entitled Taking Charge to Better Your Health, and you can do it. In discussing today's topic, I will touch upon three things. I will examine the culture of health and disease. I will share with you three stories. And I think that I was, in fact, fascinated by these stories because I learned a lot from these stories, as many of my colleagues and patients going back a few years ago. And the question that I'm going to ask is, what is it you and I can do to improve our own health as citizens, as people outside of the medical care system? And I think that's important, and that's what I want to talk about. Clearly, as you can see, this is a little complicated, but shows you that we have done well. I mean, if life expectancy is an indicator of how well we are doing worldwide, then of course you see we've done well, and as Qatar has done. And we are continuing continuing to make advances. A lot of these advances have to do with improvement in primary care, with public health. We are picking up the diseases earlier. We are diagnosing them quickly. We have newer treatments, newer medications. Cancer therapy has done wonderful things to patients with cancer. Surgical care has improved. And of course, more recently, a lot of focus on vaccinations, hepatitis B, shingles, and of course, a few months ago, COVID-19. Now, that being said, we are surrounded by challenges that might be holding us back. I feel we can do better. And here are some challenges that I think form the basis of my discussion later. And it's to lay the foundation in terms of examining, as Dr. Chima said, the contemporary culture of health and disease. We are surrounded by many chronic diseases, heart disease, cancer, and so on and so forth. More recently, we were hit by a pandemic. We've never seen a pandemic like this in the past 50, 60, 70 years. We engage in lifestyles, which I would call sometimes irresponsible behavior, reflection of how we behave in terms of what we eat and so on and so forth. The environment also causes problems. And a case in point is air pollution. It is believed that air pollution worldwide is causing about 7 million deaths. Use of pesticides, use of chemicals, our public health systems, delivery, the cost of care, and the other softer, non-clinical, very important variables such as poverty, inequity. All of that happening in a world which is very complex. So let me, in the next 5-10 minutes, go through these challenges in the changing world that we are living in. Our population is increasing. Urban areas are becoming dense. We are traveling a lot. And of course, passing the bugs on as a result. Flu is a case in point. We also have this shared environment with animals, more contact with animals. And what has that done? Well, not too long ago, we had the scare of avian flu, but here we are with the pandemic of COVID-19, the coronavirus. So it's fascinating to see that how one illness can actually do things that you cannot imagine. In dealing with COVID-19, we are not just dealing with COVID-19. We are dealing with the upset it has caused in terms of social, economic, and our other lives, creating uncertainty, but oftentimes, even as you may have seen it yourself in your own lives, the challenge of misinformation surrounding this pandemic. And mind you, there is misinformation with other diseases as well, as I will elaborate on it. So in this complex world, this is the culture we are in. The culture of health and lifestyle, which is characterized by competitiveness. Our expectations are high. Obviously, there are a lot of mental health issues that are coming up. Depression, addiction have become common. Most of us, in fact, people around the world are looking for quick fix approaches for our problems. We are relying on medications, technology. That reliance is profound. I am not saying there is something wrong with it, but I think excessive reliance and perhaps premature use of technology often can create problems. So this is the other challenge. We have the complex world, the environment. Clearly, in fact, WHO, World Health Organization, estimates that 25% of disease burden is linked to environmental factors. I indicated earlier that we estimate that air pollution is probably killing 7 million people worldwide on an annual basis. That to me is pretty serious. And I think we need to pay attention to that. The third challenge is the challenge of chronic diseases. And when I talk about chronic diseases, I'm talking about NCDs, non-communicable diseases, which would include diseases such as hypertension, heart disease, cancer, and diabetes, and so on and so forth. Worldwide, out of 57 million deaths, just think about this, 41 million people on an annual basis are dying because of chronic illnesses. And in high-income nations, this percentage may be higher. In the US, for example, it's 87%. In Qatar, it's higher as well. Clearly, if that's the percentage we are dealing with, it's imperative that we pay attention to these chronic illnesses. But here are the other troubling parts of the story of chronic illnesses. It's resulting in early death. People are dying earlier than they should be, who have to live normal life expectancy, they're dying earlier because of these illnesses. And before they get to you, coupled with other mental health issues, the people, humanity is suffering with pain, disability, depression, anxiety, and so on and so forth. Now, we think with the advances in science that we would have been able to control these. Not the case. I will show you some data. In fact, there is increasing incidence of obesity, diabetes, depression, other problems around the world. Now, this is the other one where I think self-care becomes extremely important. Many of us around the world are not aware that we may be suffering from some of these illnesses, or that we may need help. In fact, with diabetes, 50% of people who suffer from diabetes may not know that they have diabetes. That to me is a sad state of affairs. So let's look at these chronic problems. I think what you see in the right-hand column here are people dying because of these illnesses, right? So we say these are the killers, or in case depression, reason for disability, pain, anguish. These are the killers. But mind you, before these things happen, what are things that we go through? Here is what you see in this column. Fluctuating increases in blood glucose level, cholesterol, blood pressure, weight gain. And what happens prior to that? What happens prior to these changes happening? This is what it is. These things are happening as a result of unhealthy lifestyle practices that we engage in, namely unhealthy diet, physical inactivity, smoking, addiction to other harmful substances, stress, poor sleep hygiene, and so on and so forth. All of this, of course, occurring in certain environment, which brings in synergistic action. I refer to air pollution, and clearly the environment of inequity, poverty, and so on and so forth. So you see, it's not as simple as we used to think. It's not as though it's one agent causing in these so-called killers. Well, we call them killers because this is what we certify patients with when they die in a hospital situation. Now, if I had to simplify this paradigm, I would say, bring in unhealthy environment, couple that with unhealthy lifestyles, irresponsible behavior, and you have the outcome of chronic diseases and people dying from it. But where does it begin? Look at this paradigm. To me, this is where it begins. And therefore, there are people, in fact, this was for the first time in 2010, the US government, in its report entitled Healthy People 2010, pointed out that the real killers are not heart disease, cancer, and so on, but rather environmental behavior and nutrition factors. So we have to shift our thinking away from saying it's cancer that's killing us or heart disease that's killing us. Well, excuse me, that's not the case. Those are negative things. Those are things having gone wrong as a result of indulging in the real killers, namely the environmental behavior, nutrition factors. So the question I ask is, and we are pretty up there at Cornell in Qatar in terms of lifestyle, how well are healthcare providers trained to provide lifestyle medicine care to their patients or to the community? You know, this was a write-up in British Medical Journal. This is a journal that you pay attention to. And I will read you a quote. It sums up in terms of the inadequacy of professional education among healthcare professionals. The title of this was Prevention and Lifestyle Therapies Are the Way Forward, emphasizing the causative role of lifestyle factors that I alluded to earlier in terms of causing problems. Let's read this, written by a medical doctor from New Zealand who said, medical education is focused on being the ambulance at the bottom of the cliff rather than fence at the top. Our medical environment is still set up like this. Money talks, and there's very little money in promoting eating broccoli and going for a walk, despite them being much more effective. I think Mark Craig summarized this so well. I mean, I can show you umpteen data recommending that I think we need to change in the way we are training healthcare professionals around the world. I'm not saying it doesn't happen, but I think we could do better is the point that I'm making. So where's the future going with this? And look at this. This is the information of high income nations. This is just an illustration of chronic disease. Obesity is a case in point. Look what's happening. These are the projections. This is 2030. What's happening? It's not stopping. And these are some of the most advanced countries in the world. The rates of obesity and overweight are not stopping. And the question I often ask is, where is our research? What are we doing to stop all this? And this was a little thing from Yahoo Voices. New obesity research shows 100% of Americans could be overweight by 2048 if we continue the way we are continuing at the moment. Obviously, there is something not right, is what I'm saying. But that aside, let's say medical care and research aside, can you and I, can we help ourselves? The answer is yes. And that's where taking charge comes in. And before I get into the details, I want to share with you 3 powerful stories. Obviously, I'm just giving you these are illustrations. I wish there was more time. I'm happy to come back, talk more about this. And I will share with you these 3 stories that have either appeared in newspapers or that I have gone through them myself. One story, at least my story, my encounter with Mother Teresa in 1991. And with each of these stories, there's a takeaway message or messages concerning self-care. So let's begin with the first story. This is a story that appeared in New York Times in the opinion portion of New York Times in 2015. Let's read this. This is a story about a lady, we'll call her Betsy, who went to see Dr. Martin. This was the 6th doctor she saw. Why did she see? Because of rapid heartbeat, feeling stressed out, and so on and so forth. Dr. Martin took a detailed history. What did he discover? He discovered that she was taking over-the-counter weight loss product that contained ephedrine. It's a substance that people will utilize to lose some weight. And when she stopped taking it on the advice of the doctor, her rapid heartbeat, all her problems disappeared. Asked why she hadn't mentioned this information before, she said, nobody ever asked her that question. Until then, her providers would sooner order tests, take the time to talk to them, but take very little time to talk to them and begin to write prescriptions. Clearly a case of poor communication. And if you read this at the bottom, this is the American Organization Joint Commission, found that communication failure, rather than a provider's lack of technical skill, was at the root of over 70% of serious adverse health outcomes that are commonly seen in hospitals. Now, this has to change. This has to change. The question I'm asking is, what is it we can do? And this story appeared in New York Times, and look at the title of the write-up. Doctor, shut up and listen. Let's communicate, doctor. And poor communication is a common problem in many parts of the world. And I would say the lesson I learned from this is nothing should prevent you from sharing your story, whether it's a story about your personal problem, medications, procedures, anything that's bothering you. Insist on your sharing your story with healthcare institutions and providers. This is the second story. This was a fascinating story. It is from New York Times Magazine in 2012 and written by Dan Buettner, who became very famous, has become famous. And the story is about this Greek man called Moraitis. And I won't read the whole thing, who initially went to the US to take care of himself, finally ended up staying in the US, in New York, and then found a job, went to Florida, got married, had 3 children, bought a beautiful 1951 Chevrolet. This is when he was in early to mid 60s. Now here's what happened to him. In 1976, One day, Moritis felt short of breath. Climbing stairs was a chore. He had to quit working midday. After x-rays, his doctor concluded that Moritis had lung cancer. As he recalls, 9 other doctors confirmed the diagnosis. They gave him 9 months to live. He was in his mid-60s, a young man who was told, you have lung cancer, you're going to die in 9 months. Well, what did he decide? He decided it was time for him to return back to Icarian Greece, where he could be buried with his ancestors in a cemetery shaded by oak trees that overlooked the Aegean Sea. What do you think happened to Moritis? This is Moritis at age 100 plus, tending his vineyard, his olive grove, hanging out with his friends, socializing, and so on and so forth. The reporter, Buettner, and this is a beautiful story. I think you should read it if you can lay your hands on New York Times. How does he think he recovered from lung cancer? Asked the reporter. Moritis was asked, how do you think you recovered? Well, it just went away, he said. I actually went back to America about 25 after moving here to see if the doctors could explain it to me in terms of what had happened. And this will amuse you as it amused me. My doctors were all dead, Mr. Buettner. Obviously, Buettner got thinking. It prompted him to look for pockets of longevity of people where people are living 100 plus. Who are these people and where are these communities? And this has become the famous Blue Zone project worldwide. When you have time, please Google and see. There's a lot to be learned from this project. And going back so many years ago, Buettner identified at that time, there were 6 places where people lived long. In Loma Linda, Costa Rica, Sardinia, Icarian Greece, which is where he came from, and Okinawa in Japan. Amazing story. Obviously, the question is, what was common in these 5 communities? Obviously, these are special communities where people are living long. What is it that we can learn so that we can incorporate that in our daily self-care approaches or healthy lifestyles? And this is what was common in these 5 communities. People in these communities moved naturally. They didn't have a gym bag to go work out. They moved naturally. Their default life was such that nudged them into doing active things without having to think. It's like eating your breakfast or a snack. And the emphasis was remain active in your life. And you can do that without having to go to a gym or what have you. Keep yourself active. The second thing that was phenomenal about these people is that they basically subsisted on plant-based diets. Green leafy vegetables, fruit, whole grains. They avoided added sugars or processed foods, and they didn't routine eat in excess. Of course, there was some fish, some turkey and things like that, but basically it was a plant-based diet. What else? They belonged to a faith-based organization. They adopted routines that shed dress. It could mean taking a nap in the afternoon, like Icarians do, praying, going to a temple, going to a mosque, meditating, having close relationships with your loved ones. The emphasis on family and friends matter in this story was important for those people. And this was fascinating, having purpose in life. It is believed based on research that if having a sense of purpose in life is worth up to 7 years of extra life. Obviously, this was amazing. So the question I'm going to ask in the next minute, obviously there's not much time, is there scientific evidence to all this that Buettner has been writing about? And the answer is yes. I'll share with you two powerful studies that have demonstrated that you can actually reverse and treat heart disease and diabetes. This was published in the Journal of American Medical Association in 1999. You know, when you read this, you say, well, you know, this is JAMA, 1999, it happened. Basically what Dean Ornish did, he's a famous researcher, a preventive medicine specialist in California. He took a group of patients with heart disease. The one group, he gave these lifestyle interventions. vegetarian diet, aerobic exercise, stress management. People were told to stop smoking, and psychosocial support that I was referring to. That compared with a control group that went to a doctor, sought the usual care for people with heart illnesses. What he saw in the following 5 years was amazing. What did he see? In the lifestyle medicine group, this is the one that I was telling you about, vegetarian physical activity. If this was the arteries opened up. In this one, the control group receiving the usual care, the arteries got narrower. And more importantly, the number of complications, cardiac events in 5 years that followed, less than 0.9 per patient complications as opposed to more than 2 in the control group. Clearly a demonstration of the fact that lifestyle regimen that Dean Ornish had put in, and he's become very famous now, was clearly effective in treating and perhaps reversing heart disease in these patients. Look at this study. It's on diabetes. Diabetes, we know, is going up. We're concerned about diabetes in the state of Qatar, other GCC nations, and many countries around the world, including Asian countries such as India, Pakistan, USA. So I won't spend too much time, but this study that has received worldwide attention, published on 2 occasions in the Lancet. The Lancet is the famous journal from United Kingdom, but basically showed that when you compare diet, structured support, and no meds, no medications, and compare them with the usual care that diabetic patients are receiving, at 12 months, there was 46% of diabetes remission in the lifestyle medicine group, as compared to 4% in the one that received the usual care. People often say, well, this goes away in time. Well, at 24 months, the improvement was still there at 36% level, which is pretty high. If after 2 years, you can basically cause remission of diabetes in 1/3 of your patients by using this lifestyle approach, to me, that's wonderful. That's amazing. There's a lot to be learned about what lifestyle medicine interventions can do. So what are the takeaway messages from the story on Moraitis, Dan Buettner's write-up, and some of the things that I've shared with you? Eat plant-based diet in moderation. Variety is important. Fish and chicken is important. I usually recommend go very, very low on red meat. Avoid if possible, but go very low. Avoid salt, processed foods. Excessive eating is not good. Maintain an active, healthy lifestyle, physical activity. Don't have to go to a gym, but do what I showed you in the picture earlier. Managing stress, social support, and healthy relationships are vitally important. Having a purpose in life. And with all that, based on what I've shown you, and there are plenty of other studies, that you can actually reverse and effectively treat chronic conditions such as heart disease and diabetes. This is a story with Mother Teresa. And of course, this is me right there. I look different then. I was more youthful, much younger. And I'll share with you a story, my encounter with Mother Teresa. This is when I was at New York Medical College and Westchester Medical Center, going back about 29 years ago, 1991. And Mother Teresa had requested the dean at New York Medical College to send in a team of international health experts to help her see patients in Albania, which is what we did. And here's our team that flew, spent a week there, saw thousands of patients. And what happened one evening was that there was a knock on my door, and there was a sister who worked with Mother Teresa, and she said, Ravinder, Mother Teresa wants you to come down. This is 11 o'clock at night, and come and take care of this patient. And I said to the sister, sister, it's 11 o'clock. She said, no, but she wants you, come down. So I go down, and what I see is a man on a stretcher, appeared to be doubly incontinent, paralyzed with a drip. And the mother says they've driven more than 100 miles to come and see American doctors. 11 o'clock at night in an outpatient facility like a clinic. And I'm saying, what am I going to do? I don't know. I'm started to scratch my head. What is it? This is somebody. So sure enough, as I talked to the relatives by translation, they informed me that he fell from a tree about 10 years ago and has been paralyzed since then. A chronic patient, doubly incontinent, paralyzed. What can I do? So I looked at Mother Teresa and I said, Mother, there is nothing I can do. She said, what do you mean? There's nothing you can do for this patient? I said, Mother, I can call New York. We can arrange transportation. No, 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 no. I want you to do something right now. And then, of course, like we all mean well, we are healthcare professionals. I said, I can hold his hand and give him some vitamins. And she looks at me, she says, that's exactly what I want you to do. So next few minutes, we talked, we took care of them, they thanked us, and they left. And I started to walk back to my room, which was on the second floor on the church. She says, come back. And this is what she said to me. The biggest disease of mankind is the disease of absence of love. And as she went on to explain that there is this compassion missing from our healthcare delivery systems. And I tell you, sure enough, and this is from another American famous scientist, when love and skills work together, expect a masterpiece. And I have seen in my professional life in treating chronic patients, when you do that, when you bring in empathy, you bring in compassion, you can cause miracles. And that night I slept, and I thought about what she had said. What I learned from her that night was it is important to treat the patient, the person, with a problem than to treat the problem in a patient. You see, there's a distinction. You have to treat a person as a whole with a problem than to treat the problem in that person. Patients are people, treating the person, not just the problem or the disease. And that's what we call holistic approach. The so-called patient-centered care that we talk about day in and day out now is what Mother Teresa taught me in 1991, clearly with implications for people, for consumers, and for people such as yourselves. So what did I learn from these three stories? That lifestyles are critical, which is where you and I come in as individuals. Non-clinical social variables can play an important role, relationships, having purpose in life, connecting with people. Patient-centered care is important, and it's important that you become an active participant in your own care. Bring notes with you when you go to see a doctor. Share your story. Tell them how you feel. Ask questions. So what can you do? Let's be a little more precise in the next 5 minutes, and then I'll stop, take any questions that you might have. This is, and I won't show you evidence, this is enough. This is a wonderful masterpiece document from United Kingdom Department of Health in 2005. The document is entitled Self-Care, a Real Choice. Two important quotes from the document. One, people who participate actively in their own healthcare have better outcomes, higher level of satisfaction, and fewer visits to their healthcare provider. And also the expenses incurred among those people is much lower. So self-care is what you and I do for ourselves to maintain health and to prevent and deal with illnesses and health problems. You can do that. I can do that. Everyone, every citizen on this planet can do that in terms of diet, activity, sleep, social connectedness, stress management, avoiding harmful substances such as smoking. I tell people, no matter how you look at cigarettes and smoking, 360 degrees all around, there is no benefit to it, none whatsoever. And more importantly, empower yourself. The more questions you ask, the more information you have, and the better informed decision you will make insofar as your disease is concerned, your illness is concerned, also for self-care. Self-care is the foundation of healthcare. It may be outside of the medical care system, but remember, you're an important player in that. Self-care is vital. It plays an important role in good health, of course. When we are healthy, we eat good. But may I suggest to you that you can continue with self-care. And I'll share with you how, even if you have or run into problems such as when you're seeing a primary care practitioner or you're going to a hospital and so on and so forth. And how can you do that? Here are some guiding principles, which I hope, inshallah, will be helpful to you. The one thing I would begin by saying, do not diagnose or self-treat yourself, please. You are not a doctor. As an ordinary citizen, some of you may be doctors sitting in the audience, but please do not indulge in self-diagnosis other than taking care of yourself in terms of routine problems such as common cold and so on and so forth. Okay? You, however, can participate in your care even after having problems in a number of ways. Look for practitioners or facilities that deliver patient-centered care. I gave you the example of Mother Teresa, where you feel by word of mouth that practitioners are more compassionate, they are more empathetic. Ask questions of your providers. Question them on the diagnosis, medicines, doses, frequency, procedures. And by the way, if they request a test, make sure you call up and find out the result of the test. Sometimes people are busy. Make sure. And as I said to you, share your story, share your problems with a healthcare facility, with your doctors. Do not hesitate for 1 minute. It doesn't matter what the doctors might say. Adopt healthy lifestyles. There's a role for healthy lifestyles in hypertension, diabetes, heart disease, obesity, depression, anxiety, osteoarthritis. Do simple stuff. We've seen COVID-19, simple stuff, hand washing. That being said, there remains uncertainty. I'm not saying everything is perfect. And of course, COVID-19 has amplified that. There's uncertainty, oftentimes ample misinformation. When you listen to all kinds of stories, read newspapers, listen to stories from all people, obviously misinformation will creep in. But may I suggest to you, let science guide you, help you make informed decisions. Rely on credible information, not on any information. And especially when information is coming to you from all over the place. This is a Berkeley School of Public Health newsletter. This is 2018. When somebody Googled looking for information on cholesterol advice, how many hits did they get? 78 million web pages referencing cholesterol. How can a simple human being tease out, discern between what is useful and what is not useful? Relying on credible information is extremely important. And here are some additional guidelines. When you have something that tells you things such as carbs are toxic, well, you know carbs are not toxic. Okay, you can take care in eating them less, and so on and so forth, but they're not toxic. Recommendations which are based on maybe just studies done by people who are not scientists. Recommendations based on just one study. Something that promises a quick fix. Oh, you take this, it'll cure your problem. And sometimes ask yourself, is this claim too good to be true? Well, think about that. That being said, you can turn to your credible information. And here are 3 or 4 guidelines. Look at authentic, sometimes government information, moph.gov in the state of Qatar, anything to do with WHO.WHO, NIH.gov in the US. Fantastic websites, fantastic. Medical schools, those ending with .edu, Harvard, Mayo, Cornell, has fantastic health information websites. Professional associations, go to American Society of Nutrition, American Public Health Association, American College of Lifestyle Medicine. Look for those rather than going to some of these that might raise questions in your mind. Obviously, I would love, all of us want to live long. We want to have a good quality of life. I think self-care can play an important role in helping you live long and live long enough with good quality of life. This is a picture of a French woman who lived to be 115 years. I think there are studies that say that the human span life could be as much as 125 years, 130. I think it'll be nice to be able to live that many years with absolutely no problems, no handicap, and enjoying a good quality of life. So here are some quotes. The best healthcare plan is a self-care plan. We can adjust the wind. We can't adjust the wind. Obviously, some things will happen to us, but we can adjust the sail. Dolly Parton said that. Those who think they have not time for bodily exercise will sooner or later have to find time for illness. As a doctor, I'm often told, Doc, I'm too busy. I don't have time. If you feel burnout setting in, if you feel demoralized and exhausted, it is best for the sake of everyone to withdraw and restore yourself. Restore to stress shredding techniques, meditation, praying, and so on and so forth. And I will share with you this slide that when I looked at it, I was just blown away. As we go through our lives, this is what I'm saying, we will, of course, have issues. We will develop problems. You know, life is not perfect. You cannot be 100% perfect all your life until you live to be 125. You will succumb to illnesses. I will succumb to illnesses and injuries. And I think in that story, self-care is important. And I think giving up is not an option. And this is what Trent Shelton said. We are all a little broken, but last time I checked, broken crayons still color. So with that, I want to thank you, Shukran, for listening to my comments.
Well, thank you very much again, and have a good evening and a wonderful week, and look after yourself, everyone.